Hello everyone, this is Dr. Virendra Sandhu, Chief Gastroenterologist from Aster Hospital. I am here to have a podcast with one of the famous cardiac surgeons, senior cardiac surgeon, Dr. Divakar Bhatt, who is having more than 25 years of experience in cardiac field. I'm happy to share that the Aster Hospital is going to conduct a marathon on September 29th, and I'm happy to say that our Dr. Divakar Bhatt is going to be the program director of this one of the biggest event in Bangalore city. Hello, sir. How are you?
Hi, Virender. Yeah, this is a special event. This is, I can say, one of my dream. And uh, I know you are a regular marathoner, long distance runner. You have done Kardungla Pass, which is one of the most difficult run, and comrades in 87 kilometers. So we all know the marathon is for 42 kilometers, and I wanted to do one event for the sake of heart, with which I am working every day. And the way you work with gastrointestinal system, I work with cardiovascular system, and we all know the importance of exercise, running, and other things, so that we will discuss and then we will tell about this event in detail.
Yeah, September 29th worldwide celebrated as World Heart Day.
That's why we
Yeah,
have selected this day to conduct this event. Yeah,
luckily September 29th is on a Sunday.
Sunday,
Good for all
and
the runners.
good for all the runners. And Bangalore has got a big running community which
Yes,
boasts around 25 to 30,000 runners.
yes.
What I heard. And this World Heart Day is celebrated globally, all around the world. The most common cause of death is cardiovascular disease and stroke,
Yeah. That is
and
happening in young people also
young people.
nowadays. Yeah.
And so the idea is to bring awareness among the public. So how we can do this? So this is by conducting these sort of events annually. So for so
Good.
many years this has been happening, and every year we are given one theme. This year theme is use your heart for action.
Okay, nice.
So this event rightly fits into what I am doing,
Yeah.
the Heartathon.
So in the marathon,
Yes,
there are some categories like a 10K, 21K, full marathon, and ultra marathons.
yes.
As a cardiologist, why you chose 7.2 miles and 3.6
Yes,
miles?
yes.
What is the uniqueness of
Yes,
this
yes.
marathon?
I wanted this to be unique in many ways. So in the beginning, I thought, let us do a 10K or 21K. 21K is half marathon, and
Yeah.
42K is full marathon. Since majority of the runners cannot do this long distance, that's why the 5K and 10K has become popular. So I thought this distance should be something unique to the heart, special to the heart. So everyone knows that the ideal heart rate is 72 per
Yes.
minute.
Yeah.
So if your heart rate is around
Around
72,
70. Yeah.
72, and your stroke volume is around 78, you will have ideal cardiac output. It's a healthy sign.
Yeah.
So to sort of spread this awareness to everyone that one should have an ideal heart rate, that's why I've kept this as a 7.2 miles.
Miles. Yeah. That means around 11
Yes,
kilometers.
around 11.6
6
kilometer it
kilometers.
comes, and
Okay.
so many who runs 10K should not be a problem.
Problem. Yeah.
And while we were planning to conduct this, we decided this should be a timed event, because majority of the runners likes timing.
Timed events. Yeah.
In what time I ran 5 kilometer, in what time I ran 10 kilometer. Everyone is very keen to know that. So what we made is this 7.2 miles. If someone can finish in 72 minutes,
1 hour, 12 minutes.
1 hour 12 minutes, it's like a dangling carrot. it
Yeah.
is it is not easy, but not difficult.
Yeah. It's not difficult. Sub 6
Yeah,
pace. If
sub
they
6. And
yeah.
majority of I will say
Yeah.
probably 30 to 40% of the runners
Definitely.
will be
Definitely.
able to do
Those
this.
who are able to do
Yes,
sub 60 10
10K,
kilometer,
10K.
they're easily they are able
For them
to
it's
achieve that.
challenging.
Yes.
And the second unique feature of this hackathon is we are conducting this in a residential area.
Yes.
Unlike many running track
Yeah.
events,
JP Nagar.
JP Nagar,
JP.
around our hospital, Aster RV Hospital. Aster RV Hospital has got excellent
And which has
cardiac
got a
science.
great shade
Yeah,
also.
yes. great shape.
Green.
And many people, public will see people running for a cause. Here we are spreading a message. Every runner will spread a message that
Message.
I am
Yeah.
running for a heart,
Yes.
for the heart health, to prevent heart problems. So this message will spread across the residential areas. Many people will see people running in front of
Yeah.
their house and they get motivated. So this is the idea behind the conducting this event,
Okay. Nice.
Heartathon.
Yeah.
Yes.
Yeah. And anything about medals, sir? And I heard that
Yes,
some
yes,
you are providing some unique medal
yes,
those who
yes,
finish.
yes. Every runner, every one who finishes the finisher, finisher will be given medal in majority of the running events. So this being a heart event, I thought why not you make a medal in the shape of the heart,
Oh,
so that
beautiful.
every runner will keep this as a great
Yeah,
memento in their
memento, lifetime
lifetime
memory.
achievement. And
Mm.
so we are coming with a very unique shape, heart shaped medal. It will be like their exact heart replica. So since they have spent one day for this running this event and participating, so they will remember for this ever.
Yeah, nice,
So
sir.
that way the finisher medal will be unique. Apart from T-shirt, which will have a lot of unique features about the heart, like running ECG
Oh,
and heart shape
yeah,
figures on
yeah,
T-shirt.
yeah.
So those things are many running events will
Okay,
do. Yes, the medal will be unique,
unique.
heart
Yeah,
shaped,
good,
and people will remember.
good, good, good. Coming to running, sir. How you started your running? Now I think you look
Ye-
very young. You look
Yeah,
very young.
I'm also runner, but
I know you
I'm
you run
yeah,
sub
yes,
2 hours half marathon,
yes.
which is very good pay.
Full
Yeah,
marathon also I have done under 4 hours.
under 4 hours. That is a great achievement.
Yes.
How you started? What made you to run?
Yeah. Probably a colleague like you only has,
Motivated.
inspired me, motivated. I had an anesthetist by name Dr. Yuvraj. He was running,
Okay,
and my in previous appointment with Malya Hospital, Kantireva Stadium was just in
very
front,
close. Yeah.
and many sports people I used
Yes.
to see, people used to run. So probably that motivated me. And every day seeing heart problems and heart patients, so that was thought of. I was convinced
Okay.
that physical fitness is the mantra for having a good health.
And some
I,
people say that there's a myth like by running your heart becomes weak, and there are so many deaths we see during events. What is
yes.
your thought about it, sir?
It is totally wrong.
Yes.
Totally.
We
See,
need to give a
yes, yeah.
correct message to the public.
Giving a very clear message. Yes, it has happened. I'm not denying it. There are
There
deaths
are, yeah,
on.
the events. Even in last
Yes,
Mumbai marathon,
yes,
young chap, seasoned marathoner, he
yes,
died.
yes. See, heart is a muscle.
Yeah.
Any muscle will get stronger if you use it more. Simple, common sense. There is no second thought about that. See, this happens when someone does not listen to their body. Everybody gets a sufficient signal. See, you are running and you are getting a palpitation, you are having irresistible chest pain. That means your body is asking you to stop.
Stop.
The person would not have stopped. Person would not have seeked the medical help. That's when these things happen.
Okay.
Otherwise, in my opinion, everyone gets sufficient signal. One should know how to listen to
When to
their body,
stop.
when to stop.
When to stop.
Yes.
Yeah. Before running, if they start, see, you told you started your running journey being a cardiologist. It is
Yes.
very easy for you. For
Yes.
general public, before they start that running journey,
Yes.
what are the precautions they need to take and what they need to do?
Yes. If someone is above 35, 40 years, I will always recommend them not to start directly.
Yes.
Never. First, you have a thorough medical checkup, maybe treadmill test, echo, and take a doctor's opinion, and start gradually
Gradually,
and
not
increase.
increase the
Yeah.
pace. Yeah.
First, as
Like a structural abnormality, we need to
yes,
rule out.
maybe
Any
that.
rhythm disturbances, we
Yes,
need to rule out.
yes,
If they got any ventricular tachycardia or
yes,
any rhythm disturbances, first we need to rule out.
yes,
Under tremendous stress during running,
yes.
high intensity sports, it may precipitate cardiac arrest. Those things
Problem.
we need to
Yes. First get a green signal
green
from
signal
your
from the
doctor.
doctor.
Then you strengthen your muscles. increase the distance gradually. Never first day itself don't run 10
Yeah, I see a
kilometers.
lot of
Yes,
runners
many
within
people
six
do.
months they would like to do a full marathon.
Never do that.
Yeah.
And this timing and all, see, we have kept some challenging 72 minutes, 7.2 miles. Don't go by those things. It is just a
Yeah.
parameter. You listen to your body. I always keep telling, even when we are operating, if you want to do a faster operation, you can't do that.
Yes.
The speed comes automatically.
Automatically
You
by
should never aim for that.
yes.
In running also, I know you
Yeah.
as a runner, you will agree with me. The speed has to come by
By
practice.
practice.
If you want to run speed, you cannot do that.
Yes.
So that's my advice. Don't aim for the speed.
Yeah.
You rather concentrate on other benefits of running.
Running. Yeah.
Okay.
Apart from cardiac
Yes,
benefits,
I think you are
there are
the. I
yeah,
think I
there are
think
so many other benefits
yes, yes.
also.
So first, let me ask a question to you. You are a famous gastroenterologist in the town, Bangalore town. So Dr. Virendra Sandhu is well known, and he's a excellent marathoner, and many long distance runs he has finished. So you please enlighten us the advantages of running regarding gastrointestinal system,
Yeah,
liver,
yeah, yeah,
stomach,
yeah.
acidity. So the
So yeah,
commonest
yeah. One
problem
of the
people say is
commonest reason,
acidity.
yeah, one of
Yes,
the commonest problem. See, around 30% of general population got acid reflux. We call
yes,
it gastroesophageal
yes.
reflux disease.
In
One of
fact,
the commonest reason for
in fact,
this,
many of your patient comes to me thinking that it's a
it's an
heart
auto.
attack.
Yeah,
I
yeah, yeah.
send it to you.
It's called a non-cardiac
Yes,
chest pain.
yes,
Yeah.
yes.
One of the commonest reason for this GERD or non-cardiac chest pain or acidity is overweight.
Okay.
If there's a overweight, what happens? The sphincter between food pipe and stomach becomes weak. The acid which is normally produced in the stomach comes up, causing reflux. Then they may think that it may be due to heart condition. No, it is due to acid
Acid
reflux.
reflux. Yes,
By running, if they lose weight, the
yes.
sphincter becomes tight.
Excellent. Hmm.
Then reflux will go.
So this is probably
That is
one of
one of the benefit of running.
yes,
We can prevent
and
acidity.
probably one of the cheapest
Cheapest, yeah,
cheapest
cheap.
treatment for
Yes, yes, and also
you will lose a lot of patients, but a
no,
lot
no,
of patients will
yeah,
help.
the lifestyle disease. It's
Yes,
a lifestyle
lifestyle.
disease.
Yes, yes,
Yes, next commonest reason is overweight, overweight and diabetes.
yes,
That in turn causes
yes.
fatty liver. Those who undergo
Mm, mm,
any the above the age of 40 years, if they undergo any ultrasound scan,
mm.
we do see a lot of fatty livers. Fatty liver, those who are not taking alcohol also. Those who
Yep.
take
Mm,
alcohol, we
mm,
do see fatty liver.
mm.
If they don't take alcohol also, there will be a fatty liver. One of the commonest reasons for fatty liver is overweight.
Okay.
If they lose weight, fatty liver will disappear. It's a reversible condition.
Yes.
If it is unattended, it may turn into cirrhosis over a period of 10, 20 years.
So if they just start running habit,
Yes.
the weight reduction
Weight
happens
reduction
automatically.
automatically, diabetes will
They
come
won't get
down,
diabetes.
metabolic syndrome will come down,
Yes,
cholesterol will come down.
yes, and
And
they'll
they
get
can prevent liver tumors, liver cancers also.
yes,
And also they can prevent irritable bowel syndrome also.
yes. That's very
Yeah, that is one
important.
of the important
See
reason
the
in stressful metropolitan city like in Bangalore. All most of the youngsters, especially IT and those who work desk job, sedentary lifestyle, they will have a lot of irritable bowel syndrome by running, by doing proper exercise, pranayama, yoga. Even IBS can also be
IBS.
treatable.
And another common problem we encounter in geriatric age is because of the sedentary life. They say, I won't pass gas, my constipation
Yes.
problem
Yeah.
increases. And is it true if they increase their activities, maybe brisk
Yeah.
walking or
Brisk walking
walking,
and fast,
running?
yeah, slow
It
jogging
is a
and
treatment
running.
for
Yeah, yeah.
constipation.
Yes, yes.
Yes,
Colonic motility will improve. Even
yes,
constipation will also
yes,
improve.
yes,
And also they get a good sleep.
yes, excellent.
One of the
So for
benefit
the
of running
runners,
is a good sleep.
at this point, I would like to tell one point. For the runners, I'm sure you will also agree. When you start running in the morning, many times we pass flatus while running because
Yeah.
see that is a
Intestinal
proof for
activity. Yeah.
you to say
Yeah.
that your intestinal health is getting improved.
Better.
So you can feel the benefits of all these things.
Yes.
And
And
by
even,
regular running, as he tells, your appetite will be good. You will
yes.
get good sleep. You will come across so many running friends,
Yeah.
and your interactions will
Yeah.
improve. And all these things I'm sure we will provide in this Heartathon
But,
event. At the
yeah,
end of the marathon, you will have a lot of
and they
friends
will
here.
go back with a runner's high.
Runners, yes, yes.
That is very important.
Runners high,
Yeah,
yes.
they'll be happy.
They will be
Yeah,
happy.
the
Yes,
running causes releasing of good hormones,
yes, yes.
endorphins. They'll be
Endorphins,
happy, and
yes.
they in the corporate sector there'll be an improved interpersonal relationship also. Even
Okay.
family life will
Yes,
improve.
yes, yes. Okay, at this juncture, I want to ask you one question. Many of these IT guys and so-called high-end affluent society people, they don't want to come out on a road and park. They will say, "Doctor, is it okay if I run on a treadmill
Mm.
inside my cabin?" What is your advice?
Personally, I don't believe in running on a treadmill.
Yes, exactly.
Yeah,
So I would like to
yeah.
sort of
When it is raining, if it
yes.
is not able to, if you
Hmm.
don't have time, yes, for 10, 15 minutes for warm
No,
up, you
even
can do.
even orthopedics doctor we
Yeah,
can talk
yeah.
bring one day discuss with orthopedicians. Even they say it is not advisable to run on a moving
Moving
object,
object.
whereas earth road is a stationary.
Yeah.
You decide your speed.
Yes.
Running on a treadmill is not good for your knee
Needed
joints
for long. Yeah.
for long,
Long.
because every second your body is trying to adjust to that speed.
Yes.
Your body is not meant for that. Your body is meant to run on a
Station.
stationary
Yeah.
object. There are other advantages of running on a road or park, because see, you
Lot
are
of
with the
people.
nature.
Yeah.
You see a lot of people. Someone will say hi, good morning.
Yeah.
You will get a good smile. That
You'll
one
make
good
lot of
morning,
friends also.
yeah, then one good morning and one good smile will sort of change your thinking process. Otherwise, in between four walls, all the stress will be in your
Yeah.
body. You will be keep thinking about your office work. You may be running, but your mind is occupied with all
Yes.
nonsense things. Whereas when you go out and see some smile, somebody's good morning, or hear some birds chirps, see some green trees. So these are all added
Positive. Yeah. Yeah.
advantages, and
Positive
with
effects on our body and
positive
mind.
effects,
Yeah.
and all these things comes free.
Yes.
You need not invest
Yeah.
on a
Yeah.
treadmill.
Yeah. Yeah. As you rightly said,
Yes.
running is one of the cheapest sports.
Cheapest
Cheapest
sport.
sports, and you
May,
don't require anything. Just one pair of shoes,
yes.
and you can do this running wherever you go.
Wherever you
Like a for tennis, badminton, you require a lot of infrastructure. For running, you require only your mind
yes.
and one pair of shoes and positive attitude.
Positive attitude, and make it a point that I'll spare half an hour or one
Yes.
hour per day.
Yeah.
Yeah, there's another recommendation. Do you recommend running every day?
No.
Yes.
See, we got 7 days. See, I belong to one of the famous running community in Bangalore, so Trailblazers.
Wow, good.
My guide, his mentor is Mr. Chandrasekharan. He always advocates 3 days of running,
Yes.
2 days of stretching. Stretching is the cross training. It may
Yes.
be a simple body weight exercises,
Hmm.
yoga, or some cycling, and 2 days of rest.
See,
2 days
very,
of rest
yes,
is a
very,
must.
yes, very important.
Yeah, 3 days is sufficient, more than
Hmm.
sufficient.
Yes, very, very important informations we are
Yeah,
sharing, and
I think, yeah, if you come to our run on September 29th,
29th.
and we can provide you runner's high
Yes, and it is happening in
and
the center of the city
center of the city,
and in a residential area, and
and you will go back with a good memories.
and you need not worry about your health conditions, because it's happening around the inside the hospital, around the hospital.
And
Doctors
you are
will,
running with the doctors,
you are
doctor
running with
groups.
doctors.
That is the advantage.
Yes, and you will go with lot of sweet memories, including a very special medal,
Hardship, yeah,
lovely t-shirts, healthy breakfast, and you will have lot of
good memories.
good memories, good friends.
Thank you.
Thank you.